everyone out there. This is Dr. Andrew Campbell, and I'm going to give you a presentation about the gut, gastrointestinal system, and how molds and mycotoxins affect the gut, and then it affects us completely. So basically, just some things that I do. I'm the editor-in-chief for several medical journals. I'm a reviewer for a couple of medical journals, and I'm on the editorial board of some others. And I also have published over 100 studies in medical journals. I have published chapters in medical textbooks. I've lectured at least 6 universities. It might be a couple more. And I'm a fellow of the Royal Society of Medicine in London. So this is going to be based on medical evidence. What does that mean? It means it's based on the best medical and scientific evidence combined with the doctor's clinical expertise. Now, medical evidence is not opinion and it's not anecdote. What do I mean by that? Oh, I tried this and it helped me a lot. Oh, that's an anecdote. And then, if you haven't, this medicine works for this, okay? Show me the medical evidence. Show me a published study. That's what I mean. Because in medical school, I was taught, God we trust, everyone else has to show evidence. And that's what I mean by evidence. Has to show the data, not just you said so-and-so said so. So Dr. Facebook, Dr. Google, and all those are basically out of the picture. This is a medical advice disclaimer, and you can read it at your leisure. So I'm going to start this by showing you what people are saying. I was wondering if you could recommend a doctor. It's for one of the women in my group who has been on these crazy Shoemaker Nathan Gupta protocols for quite some time to no avail. Here's another one. Is it me, or do the majority of mold practitioners look at this as a cash cow? She's right. Or at least the Shoemaker practitioners. They make a lot of money telling patients the same thing over and over again. Take the VCS, take the fish oil, cholestyramine, clear the marcons, fix the hormones, do VIP to fix the brain. Only problem, I've been doing it for 3 years and it doesn't work. And that is so common. I get these emails all the time. And also I got this one. I came across your videos on YouTube. My son was exposed back in 2020, and he's been struggling with symptoms of severe fatigue, brain fog, depression, anxiety, and rage. He waxes and wanes with these symptoms. We've been following the Shoemaker protocol with vitamins, supplements, and binders, ordered by a nurse practitioner. We are all very frustrated that he hasn't gotten any better in 5 years. Again, it doesn't work. Here's another person said, I've consulted with different MDs and naturopaths, but nothing has worked. My current naturopath has me on binders, zeolite, clay, and charcoal for about 6 months, but I'm convinced they're not binding any toxins. The naturopath gave me a course of nystatin, but that's the wrong medication. It did absolutely nothing for me. We have done urine lab work, but I also understand that's not a valid test. Correct. I've watched all your videos, and I very much want to use your treatment. I was formerly seeing a functional medicine doctor, was trained by Neil Nathan, but I've not made progress on this protocol for the last 3 years, folks. 3 years of this person's life lost. I've been dealing with mold toxicity and trying to get to the bottom of everything because I'm not getting any better. I was blown away by your thoughts on binders because they're pushed by pretty much everyone. I have been taking them and I haven't seen much of a difference. So learn from this, folks. I have seen over 5 naturopathic doctors. They prescribed herbs, binders, and cholestyramine. These things just made me worse. So on and so on. So Here's a positive one. I must say that your treatment program was working just like you state in all your videos and technical papers. On the 4th month, doing the paradigm to the letter, I was feeling 85% better at that point. 4 months, not 3 years or 5 years like these other ones you just heard. 4 months. The fatigue attacks had disappeared. Brain fog and mild cognitive impairment was much less. And I even had to reduce my thyroid medication, etc. Yes, folks, do the right treatment, you get the right results. Do the wrong treatment, you don't get any results. And this was from a doctor, Dr. Campbell. I'm simply blown away with your knowledge base. After hearing your lecture at the A4M conference, I dove into your videos, and I wish I had met you years ago after getting sucked into the shoemaker Nathan vortex. At least going forward with your direction, I will be able to truly help my complicated patients. So what you hear again and again, the shoemaker, the Nathan, the Jill this and Jill the other, they don't help people, and then they end up emailing me and I help them. I'm putting this up here because wrong does not cease to be wrong because the majority believe in it. And this is my favorite. That was said by Leo Tolstoy, the famous author. And then Sir Winston Churchill said, if you have knowledge, let others light their candles with it. And that's what I'm doing for everybody, the public and for clinicians and doctors all over. I'm teaching them what I learned over the last 35 years. Do you ever wonder why the CDC doesn't recognize urine mycotoxin tests as valid evidence? The CDC and the FDA don't recognize urine mycotoxin testing for 3 reasons. Number one, it's not FDA approved. These labs haven't validated through the FDA standard process for diagnostic tests. Number two, exposure doesn't necessarily mean disease. Why? Because as the CDC points out, almost everyone is exposed to low level of mycotoxins through food, corn, wheat, peanuts. So a positive result doesn't necessarily mean that you're sick from it. And the third one is lack of standardization. Different labs of the urine testing use different cutoffs, methods, and interpretation. This means 2 tests on the same person to 2 different labs could give different results. So what is their official warning? These tests can lead to misdiagnosis, unnecessary treatments, and anxiety. And as you saw through these emails, that's exactly right. So here's what the CDC says. It says mycotoxin levels that predict disease have not been established. Urine mycotoxin tests are not approved by FDA for accuracy or clinical use. And then this is a AI, artificial intelligence, Google. Conclusion, published studies have shown urine testing to be invalid. So here's a study that was published earlier this year in April 2025 that says this study highlights the challenges involved with urinary excretion of T2 toxin. What it's saying is that 80% of the time it's inaccurate. So don't waste your money. All these binders, all these urine tests, all these treatments, don't waste your money. What about the OAT test? Here's a study that shows several popular organic acid tests, the OAT test, claim to detect imbalances in gut bacteria and fungi, but most of the microbial markers of these tests do not measure what they claim to. Save your money. So look for body burden of chemicals. How much is inside your body, not coming out in your urine? That's left to your body. Okay. Here's a very popular test on stools. So this research article, and you can see it at the top here, there, they took stools from a healthy person, screened it for different bacteria and parasite, it was fine. So then they spiked it with 14 bacteria and 2 parasites. They sent it to 2 different labs. One was biofilm array, Specificity, 100%. They sent it to GI map, specificity 26%. What does that mean? 74% of the time it's inaccurate. And this is what the authors concluded on this study. Problematic to this assay is the poor level of specificity displayed by this assay reporting the presence of several pathogens which could cause clinicians to treat with antibacterial and or antiparasitic agents in the absence of any true pathogen, which means you're treating something that may not be there. What are other bunk sham tests? The MMP9, the HLA-DR. Oh my gosh, people fall for that genetic test. The TGF beta, MSH, VEGF, the visual contrast test, and of course, the famous MARCONS, which does not exist in medicine. Let me take you through these. VEGF is a major player in leukemias and lymphomas. Do you see anything with mold or mycotoxins? No. Visual contrast test, there's no studies linking this to molds or to mycotoxins. MARCONS, there's not one single study showing that this even exists in medicine, not one. The HLA, the genetic test, there are some who claim that it's a significant thing for patients affected by molds and mycotoxins. It's supposed to affect 25% of the population. Well, 25% of 330 million Americans is 82 million. So 82 million Americans are affected by this gene. But here's the key. There's no published studies relating this HLA-DR to anything with molds or mycotoxins. There's no research. It's not taught in any medical or health institution and has no basis in medical science. But people believe it. Don't waste your money. Let me tell you about another disease all of you out there have heard about that affects 32 million Americans. 50 million less. It's called diabetes. Everybody's heard of that, right? Yes, of course. What about this one? 82 million and nothing, no books, no chapters, no journal articles, nothing. Here's another one, the Great Delusion. Binders. Okay. So what do studies show in humans on binders? They show they are ineffective. They're effective only in aflatoxins, and aflatoxins don't grow indoors. Many studies have shown that aflatoxins are not indoors. They're outdoors on plants. They are ineffective in all other mycotoxins. Binders. Ineffective. Published study. In addition, they also bind vital vitamins as well as macro and microelements. What are they talking about, macro and microelements? Things like magnesium, zinc, etc. Well, let's talk about, so that's pretty good evidence. Let's talk about this other one, the MTHFR gene. Well, guess what, folks? This is another one of those things that people are made to believe. This gene means you can process all types of folate, including folic acid. Okay? Folic acid intake is more important in determining blood folate level than having an MTHFR variant. When getting the same amount of folic acid, people with the MTHFR genotype have an average amount of folate in their blood that is only slightly lower, 16% lower, than in people with the MTHFR genotype. Studies show that getting 400 micrograms of folic acid daily can increase the blood folate levels regardless of your MTHFR genotype. And if you want evidence, let me give it to you. Here is what it says. Gene variants are common and normal. In fact, more people in the United States have one or two copies of the MTHFR variant that don't have it. You may have heard that if you have an MTHFR variant, you should avoid folic acid and should take other types of folate, such as 5-MTHF. However, this is not true. People with an MTHFR gene variant can process all types of folate, including folic acid. Here's the studies that show that. So, what about mycotoxins in food? They are a problem in sub-Saharan Africa and in Western China in the rural areas where they store grains and rice and things like that. But these are poor areas or poorer countries that don't have very strict regulations, okay? So the amount of mycotoxin tested in foods in Western countries, Europe, United States, etc., have been shown in numerous studies to be below what is called the tolerable daily intake, TDI. And that's set by the FDA here in the United States, by the European Food Safety Authority in Europe, and the United Nations Food and Agricultural Organization and the World Health Organization Joint Expert Committee on Food Additives. So let's take a study. Look at the last three lines. An adult with a body weight of 170 pounds would have to consume about 14 pounds of ready-to-eat oatmeal that's contaminated, or 20 slices of bread in order to get sick from mycotoxins. Let me hit something here that's very important. I'm going to show you why in a minute. This is Lyme. So many patients say, I also have Lyme, or I've been treated for Lyme, and I'm going to show you all this in a moment. All these tests, the PCR test, which is Vibrant, the ELISpot, which is IGeneX, unsuitable diagnostic tests from this study published in a medical journal. The VCS, that test we've already talked about, it's ridiculous. So all these tests do not apply and do not tell you that you do or do not have Lyme disease. Let me show you why. This is a young woman called Hope, wife and mother of 3. She's 30 years old, was diagnosed with Lyme disease, mold and mycotoxins, gut dysbiosis, histamine intolerance, and was very fatigued. So she tells her story on the right, says how since her teens and going to college, she would often have to take 4 to 6 hour naps. She didn't have the energy all her friends had. She changed her diet a few years back, saw a little bit, and then after giving birth to her second child, she had the rug completely pulled out from under her, and that's when her problems really began. So look at her SIBO on the left. That's prior to starting itraconazole, treatment for molds and mycotoxins. 3 months later, and she says, first morning I've woken up with just about a completely flat stomach with no bloating. I'm still dealing with some as the day goes on, but nothing compared to what it used to be. So look at the picture on the left. She writes this. This picture is scary. I look like an addict or something. This is a few weeks after being treated for Lyme and before I had mold issues. And the other picture, you can see her smiling. I would never dream a year ago I'd be well enough to be taking my girls by myself for a day at the beach and having the energy to do it all. What else? How's she doing now? Also, I've been hitting some really great milestones. I'm slowly becoming less chemically sensitive. My stamina is improving. I'm not in pain as often. I'm noticing my breathing is easier, and I seem to be more satisfied when I eat. Not to mention, I've always wanted to go a backpacking trip with my husband, and I was able to do that for the first time ever. Congratulations. She did the correct treatment that we'll be discussing here. So here's what she was treated for Lyme. And that's why I bought those Lyme slides. So in the spring, in the summer of 2021, because she had to first get out of her home, which is contaminated, she started the itraconazole. She tried natural remedies before that, and she tried to heal her gut. It didn't work. What is the only valid and acceptable testing for Lyme? It's Immunosciences Laboratories in Los Angeles, California. And it's, by the way, it's so good, it's even patented. So let's talk about ERMI, because that's another mistake I see commonly. Do not use the ERMI test. The ERMI does not tell you if there's variability within an indoor space, whether or not there's a water problem, the extent of the water problem, where the problem is, or whether or not there's unusual types of fungi. And exposure if air samples are not used. So it's a worthless test. Don't spend your money. Let's look at the latest study comparing urine tests to blood tests for mycotoxins. So what they're saying here, and that was published in the journal Toxins, is that because of various factors such as gender, whether you're male or female, age, how old you are, your diet, and your muscle mass can influence creatinine secretion. They say you would need to do urine sampling at different points during the day. It doesn't work. And then they say the ELISA method, the one that is used by MyMycoLab to detect mycotoxins in urine serum, comes with significant accuracy, precision, and specificity. Well, here it is. That's the study. It's published in a medical journal. So what is the most precise and accurate test for mycotoxins? And you get both IgG, meaning it's a toxic reaction in your body right now, and IgE, which is mast cell activation, and also whether you're being currently exposed or this is from before. So 14 different mycotoxins, and it's available internationally. Now, let me tell you something else that's important here. In understanding antibodies, 4 pathogens, bacteria, viruses, fungi, and parasites, are living organisms, have live cell walls, etc. And they're alive. So when you have an IgG, it means a past exposure. But toxins are not alive. Toxins are molecules. Mercury is a molecule. Arsenic is a molecule. Okay, so mycotoxins are molecules. So with that, these are not living. They don't have cell walls or anything. They're just molecules. So antibodies to toxins indicate cure right now immune reaction, not sometime exposed to in the past. And here's the beauty of the test by MyMycoLab. Once the toxins are gone from the body, the antibody reaction fades away. 2 important points: mycotoxins. A mold that produces mycotoxins produces a series of mycotoxins, not one. So one mold makes many mycotoxins, and if a mold that is known to produce mycotoxins is present in a home or building, then the mycotoxins themselves are in that home or in that building. Finally, and this is great, the National Institutes of Environmental Health and Sciences, the NIH, finally came out in their website in April and said this about mold and your health. Now, you notice they talk about it, etc. They mention asthma and allergies, but they also now are mentioning cognitive issues. They're also mentioning mental health issues, immune effects, and cancer. So, and they say, be careful, don't equate mildew with mold. They're related, but very different from each other. And folks, what do? They cite 16 studies here. Do you see any gels here? or any Nathan studies or any Shoemaker studies? No. Look at number 8. That's my study. Here's what happens with mast cells. This is the IgE component of the MyMycoLab test. You see the welts, and these change every day all over the body. You can see this lady, young woman, she had it all over her body after treatment. Look on the right, 6 months treatment. So I want to bring up to you this study because it shows that chronic fatigue syndrome, fibromyalgia, various types of hypersensitivities like allergies, food intolerance, sensitivity to chemicals at concentrations tolerable by most people, sensitivities to EMF, electromagnetic fields, and even to daylight can be associated with mycotoxins. And they also mention that symptoms experienced by patients with advanced mold-related illness, such as fatigue, memory, and cognitive impairment, are those reported by silicone breast implant patients. And that is correct. Dr. Vajdani, Dr. Braubauer, and I published 20-some-odd studies on breast implants because inside they grow mold. This study went on that the neurological manifestations of patients with POTS, postural orthostatic tachycardia, myalgic encephalitis, chronic regional pain syndrome, all these conditions can be related to molds. This is a great study on cancer. 35 different cancers, types of cancers, okay? As we all know, there's cancer of the brain, cancer of the lungs, colon, melanoma, esophagus, etc. So in this study that was published in the journal Cell, they took 17,401 patients and they had tissue, blood, and serum for 35 different types of cancer. Molds were found in individual tumor types and contributed to the formation of cancer. Esophageal, pancreatic, breast, lung, melanoma, ovary, colon, brain, bone, etc. So you see, folks, it even causes cancer. Now let me show you what they treated cancer with. Instead of the usual chemotherapy radiation, they gave patients itraconazole, an antifungal. And the left two pictures here, you see a man's forehead with a cancer growing on it, and it's sticking out pretty far, okay? It's several centimeters wide, and it's raised about 1 centimeter, 2 centimeters up, right here on the forehead. 59 days of treatment later, look what happened. That cancer has essentially gone away. Isn't that great? That you can treat cancer without all those effects from chemotherapy and radiation. So what did this study show on itraconazole oral solution and intravenous formulation? They looked at a review of the pharmacokinetics and pharmacodynamics. They said it has a broad spectrum of activity, it is well tolerated, it is highly efficacious, and has considerable antifungal activity. It produces consistent plasma concentrations and ideal for the treatment of systemic fungal infections in a wide variety of patient populations. Itraconazole treatment can be specifically tailored for use in all patients, including children and those requiring intensive care. So there you go. Here's another study. Itraconazole, etc. It's available both oral and IV. It's been proven a valuable addition to antifungal drugs. It's been well tolerated with doses up to 400 milligrams per day, being generally free of serious adverse effects. Another study. Itraconazole, also known as Sporanox, is common, it was developed, has been in clinical use for 35 years with an established safety record. Why do I say this? Why did I show you this? Because people on Dr. Facebook say, oh, your teeth are going to fall out, your liver is going to fry into nothing, your hair is going to fall out, your eyeballs are going to fall out of your head, and all kinds of things. Here's the medical and scientific evidence, not anecdotes and fear-mongering common on social media. Let's talk about fluconazole. It's very limited in its ability to heal anything with mold. It's not active against aspergillus at all, and against a lot of candida as well. So here is the difference between one and the other. Fluconazole on the left column, itraconazole on the right, and you can see itraconazole hits all of them, whereas fluconazole only hits one. It does not hit Aspergillus, Stachybotrys, Penicillium, Cladosporium, Fusarium, etc., etc., etc. Now, let's go to the gut. 4 things about it. One, it has a barrier function. We're going to go through the layers of the gut and the cell types and the layers of protection. So in the last few decades, a growing body of evidence underlines the role of the intestinal barrier, the gut, in mycotoxin toxicity. It contributes to many gastrointestinal diseases when affected by mycotoxins, for example, celiac disease and inflammatory bowel disease. What is inflammatory bowel disease? Ulcerative colitis, Crohn's disease, SIBO, irritable bowel syndrome. And the intestinal barrier plays a critical role in human health. First of all, this is important. It should be emphasized that the intestine is called the second brain for a significant reason. Let's look at this and explore it a little more. Apart from the obvious role of absorption of water and nutrients, etc., the first element of the barrier is mucus. Okay, and this is a protection against mechanical, chemical, or biological attack. Okay, and it's produced by what are called goblet cells. The second barrier is the epithelial cells and the tight junctions between those cells. So you have a epithelial cell, another one, and another one, and another one, like a big long chain. But sometimes these tight junctions between the two get affected. And these are proteins, and they're called claudins, occludin, junctional adhesion molecules, etc. So the third barrier are the cells of the immune system. And these are the lymphocytes and dendritic cells, and they contribute to the immune response in the gut. These cells are the first line of defense against things that attack you, like bacteria, viruses, etc. Okay? And the gut-associated lymphoid tissue, this particular layer with lymphocytes, is literally the largest peripheral lymphoid tissue in the body. It's very complex, and the role is to primarily act in the context of what to do to maintain homeostasis, balance. How do you maintain balance in the gut? So this epithelial layer is also the first barrier against food contaminants. What is that? Artificial flavorings, artificial colorings, artificial sweeteners, artificial chemicals that are in so many of our foods and our beverages. I mean, just go to any store, any gas station, and you see, blue bottles of Gatorade, green bottles, red bottles, yellow bottles. What are those? Colorants, chemicals to give it color. And this intestinal lining of epithelial cells is very sensitive to fusarium toxin, especially deoxynivalenol and zearalenone. And in the case of mycotoxins, chronic exposure to these low doses of mycotoxins can lead to cancer. And we saw that just a little bit ago. Now, it is indisputable that these tight junctions that keep the two cells together and don't let things go in play a huge role in the maintenance of the balance in the gut. So this is when this is out of balance, that's when you get many types of cancers and also reproductive system cancers, meaning ovarian, testicular, etc. And esophageal cancer is not the most common cancer. However, its mortality rate is very high and the prognosis very poor. And so this is why it's considered a serious global disease. Well, they're very affected. This is why we have to keep the correct balance. Okay? So, for example, we mentioned hormones, we mentioned tissues. It can cause reproductive system issues such as hyperestrogenic syndrome, precocious puberty, liver toxicity, especially hepatocellular carcinoma, immunotoxicity, genotoxicity, carcinogenic, mutagenic, and teratogenic, nephrotoxicity of the kidneys, urinary tract tumors, and some mycotoxins may stimulate neurodevelopmental toxicity. In other words, as the fetus develops and also the brain. So the following events related to the presence of zearalenone in the human body can be divided into these: altered progesterone levels. So you have an imbalance and you go to your doctor and you try estrogen or progesterone creams and tablets and whatnot, and it doesn't work. And I mentioned precocious puberty, decreased sperm count, decreased serum testosterone levels, very common in men, and infertility. And I will tell you that a lot of couples that have seen me over the last 30 some odd years were not unable to have children because these problems with both the female partner in the marriage and the male partner in the marriage. Eventually, after I treated them, they got well. And you wouldn't believe, there are some kids out there named Andrea and Andrew because mom and dad were able to conceive after being treated. So just thought I'd pass that on to you. Additionally, it changes the coagulation of blood and blood parameters. So it's not a good thing. Let's talk a moment about the microbiome. There are more nerve cells in the gut than in the spinal cord. And remember about something about your gut. It is continually and persistently exposed throughout every day and throughout all your life to foods, liquids, and chemicals. So when you take a drink, in this case, I'm drinking honey, lemon juice, and water, purified. It's going to go into my gut. It's going to expose. The gut is going to say yes or no, etc. That's how it's constantly exposed. So the important thing I mentioned, that how the gut is called the second brain. Well, the gut microbiome influences brain functions through the autonomic nervous system. What is the autonomic? It's the automatic. You don't have to tell your heart to beat. It does it automatically. You don't have to digest. It's done automatically. A lot of that's the part of the autonomic nervous system. So it influences a lot of things in the hypothalamus, pituitary, and adrenal axis. And this gut-brain connection has been correlated in published studies to depression, autism, Parkinson's, Alzheimer's, and eating disorders. If you watch the previous two videos that I did, one of them is on the brain, the other one on Lyme. Look at the one on the brain. It goes through all this in much more detail. So let's talk about fungi in the gut, because the microbiome is all the bacteria. Well, what about the mycobiome? And it lives on us. It lives on in parts of our skin, for example, where there's more sweat or sweat glands, which is the groin and under the arms. It lives in our gastrointestinal tract, respiratory, genitourinary tract as well. And the presence of mycotoxins has also been related to changes in the gut microbiome composition, again, leading to dysbiosis, meaning an imbalance of the gut and promoting inflammatory bowel disease, which, as I mentioned before, are like Crohn's disease, ulcerative colitis, SIBO, irritable bowel syndrome. And this was published this summer, just a couple of months, 3 months ago in July of 2025. So let's take a look at the treatment. The first and the foremost, and before you can do anything, it's the first rule of toxicology. Get the patient away from the toxin or the toxin away from the patient. Otherwise, this is not going to work. And a person's health cannot be restored if they continue to be exposed to molds and mycotoxins. No treatment will work under those circumstances. Think about it. Say you work in a lab where they make mercury and you're constantly exposed, and eventually you get toxic from mercury, but you stay. But you're being treated for mercury poisoning, but you keep working at the lab, you're exposed at the same time. It's not going to work. It's as simple as that. You're not going to get better. You also have to minimize environmental exposure, pesticides, volatile organic compounds, processed food. What is that? And you know that. That's everything wrapped in plastic at the grocery store. Artificial sweeteners, artificial food flavorings, colorings, preservatives. Also, diminish your EMF exposure, electromagnetic field. Once you have the results of the antibodies testing to mycotoxins, so you do the first rule. What does that mean? You test your home, you remediate your home, or you move. So, for example, the young woman, Hope, in the beginning of my video, she actually and her husband and 3 girls left the house because there was mold in too many places, and they decided just to get a new house. Remember a couple of things. I recommend that you choose your inspector very carefully. Why? It's an unregulated industry. Okay? So somebody with very little experience or limited experience can come into your home, give you a report, and it may not catch all the mold or show all the mold or where it's at, etc. This is why on YouTube I have 2 videos with Brantley May, a civil engineer, who shows you what each test, the pros and the cons of each test for indoor mold exposure, etc., goes through the best and the worst, etc. Please watch those for indoor mold. Oxyconazole 100 milligrams twice a day. You take it with food for better absorption. The specific supplements and vitamins at specific doses, a total of 8. You get those from detoxpure.com. Why specific? Because let's take, for example, a study on the effects of vitamin C. That study, published in a medical journal, if it says take vitamin C, is not going to get published. It has to be specific. What type of vitamin C? When do you take it? How often? How much? And for how long? And that's why, folks, on binders, there's none of those studies. Remember that. Diet. A low histamine, anti-inflammatory diet is important to follow. And then you repeat the test after 6 months. Why don't patients get well with this treatment? Well, they watched a program on, I don't know, Instagram or Facebook, or that said, oh, take this supplement and it's going to do X, Y, Z. So they added something that's not what they should be taking. The other one is they continue to be exposed to molds and mycotoxins, either at home, at work, and at the gym, in the car, somewhere. 3, they're not taking the correct dosage. They decided to go to some shop or internet and buy whatever vitamin or supplement and taking that dose. And the last Fourth one is they're not following the 4 parts of the treatment. The treatment is the antifungal medication, the itraconazole, melatonin, vitamin D3, vitamin C, vitamin B complex, magnesium, phosphatidylserine, specific dosages. There's 6 types of magnesium. Okay? You don't want to take the wrong kind. A lot of people ask me phosphatidylserine. Well, what about phosphatidylcholine? In other programs, I've shown how phosphatidylserine in double-blind, placebo-controlled, randomized studies, which is gold standard in medicine, that is absolutely the best top, helps the brain and does all kinds of positive things to the brain. No such studies were done on phosphatidylcholine. Get the stuff from Detox Pure. It's easy, it's simple. It's where I tell my patients to go. It comes with a box. It has a 2-month supply of everything you need right there, and then at the right dosage, etc. This is what it looks like when you get it from them. So let's talk about the testing for a moment. Every test from MyMycoLab comes with a consultation with me or with my associate, Dr. Lauren Tessier, and the treatment for toxic molds and mycotoxins can come from this YouTube video that's right here. And there's webinars on treatment for toxic molds, Lyme disease, autism, autoimmune disorders, multiple sclerosis, breast implant illness, Alzheimer's, Parkinson's, PANS, chronic fatigue syndrome, fibromyalgia, POTS, and others. It's all right there free for you. So, folks, what I'm trying to tell you here is that the gut plays a huge, important role. Don't put into it something that can change it like binders. And forget about cholestyramine, Cellcore, Wellcall, and all these things. They don't work. You heard what patients say. They've been taking it 2 years, 3 years, 5 years, and nothing. And I get 20 to 30 emails, 40 emails a day, 7 days a week from people asking me for help. Now, yes, I've published over 100 studies in medical journals. I speak at an unbelievable number of medical conferences every year and continue to do so. For those of you on the East Coast, I'll be at the IHS conference and giving a lecture in New York City, in Manhattan. Hope to see you there. That's in February. That's a big conference. And come by and see us at A4M. We'll be at A4M. And several other conferences in between. I've forgotten all of them because it's a constant every 2 weeks. Folks, I hope you've learned something, learned what does not work, because so many of you spend so much money on those things. And I feel terrible about that you're not doing the right thing, because it only takes 6 months to get well when you do it the right way. So help yourself. Use the right treatment. Use the right testing. Don't go for these sham tests. They cost a lot of money anyway. They're sham. So do it the right. I hope you've enjoyed and learned from this. Next, I'll be again seeing you in a Q&A with me, so you can ask questions in the chat and I'll be answering them. Have a great rest of your day, folks. Bye-bye from Dr. Campbell.